Welcome back to Your Health television program. I'm Dr. Lisa Hernandez, your host, and today we've been talking about influenza and the flu season. Our last guest talked about what was going on in the community, in the county, in the state, and how to protect ourselves against influenza. My next expert is Andrea Zoodsma, and she is from the Central Coast Visiting Nurse Association and Hospice, and she's the director of community service there, and she's worked at the VNA for over 12 years. And not only that, she, in her role as director of community services, she works, one of the functions of that unit or that program is to provide vaccinations. And I'll let Andrea talk a little bit about some of the programs that she works in vaccinations, but one of the things I've asked her to talk about is the influenza vaccine and its importance, and kind of help debunk some of the myths that we have about the flu vaccine. And I thank Andrea for being here. She's a great partner in the community. And thank you, Andrea, for being here. So I want to start off with the first question about this flu season. What do you think about this season? Is it unusual? What are some advice? What have you seen when you're out in the community?
Well, you know, Lisa, it's interesting because in the world of mass vaccinations for influenza, VNAs throughout the country offer public flu clinics and corporate flu clinics in the same way that we do. And in this business, we say if you've seen one flu season, you've seen one flu season. And that's because, as Christy mentioned earlier, it is very unpredictable. And so this season, again, we were going along thinking everything was fine and that we'd probably completed our immunizations for the season, and then suddenly there was the increased activity and the early activity, and so we've had a number of people still coming into our clinic for flu vaccines, for which we are happy to continue to administer. People generally think, oh, you know, it's too late to get a flu vaccine after Thanksgiving or Christmas, and really that message is hard to drive home to people, that the flu season here on the Central Coast peaks in January or February, and it's difficult for people to recognize that, but here we are, and going into February, and really the flu season perhaps has not peaked in this area. So not too late to get a flu vaccine. It takes about 2 weeks to build immunity, so we always encourage vaccination well into January.
Well, I think that's a really good point that you make about the flu season changes every year. Mm-hmm. And one of the things that I say is that, you know, we need to learn from what happened in the past and what's happening currently. So hopefully this will be a great way for people to know that if they haven't gotten their flu shot, they should continue to do so even through the new year. Because we see that, you know, throughout the county, that people think, okay, well, I've missed my opportunity, and we have the vaccine and we're ready, and you're ready to give it. So hopefully they know they should go ahead and get it. You talked about how the vaccine works. Can you talk to me a little bit about, you said that it takes 2 weeks to build immunity. Talk about that a little bit.
10 days to 2 weeks to build immunity. And so we encourage people, even though you've had your flu vaccine, that you still need to use the protective measures that Christy mentioned earlier during that period of time. And I think that leads into one of the myths that we can talk about, which is, I got the flu vaccine and I still got the flu. Well, if you had an exposure to the flu during that time that you're building immunity, or even prior to getting the flu vaccine, then certainly you can still get the influenza. And I also think that with regard to that myth, people thinking that they get the flu from the flu vaccine, that as Christy mentioned, people call many things the flu. And if it's a true influenza or if it's a cold, people still will associate getting the flu from the flu vaccine, which is, as you know, impossible.
So how do you address those responses when you talk to someone and say, hey, come and get the flu shot, and they tell you, well, I got the flu shot one time, and guess what? That one time that I got the flu shot, I got terribly sick with the flu. So what do you say to them? There
are so many myths associated with the flu, and I'm always perplexed at why is it that the flu, that there's so many myths associated with. In our immunization clinic, we're often giving other immunizations other than just the flu, and people don't resist taking a tetanus shot, thinking that they're going to get the tetanus from the tetanus shot. So the flu is really unique in that way in terms of the myths associated with it.
So you just keep educating.
Right. Yep. And one of the techniques that I've used this year is when people say, you know, I never get a flu vaccine, for whatever reason, I ask them, had they ever been in a head-on collision? And most times people say no.
Right.
And I say, do you always wear a seatbelt? And they say yes. And so I've made the point that it's important to prevent the flu in the same way that you're preventing a serious injury from a head-on collision. So
that's true. So like for those folks that say, well, I don't need to get the flu shot, I never get sick. Sort of the same thing.
That's very common.
Yeah.
And then to that I also say, you know, you and I probably are healthy and in our age group are not going to die from the flu. We could become very ill and have to miss work for a week or so, but we could be carriers to people who are at risk for serious complications associated with the flu, particularly children and elderly, frail people.
So so this leads me into the question about something that I don't know if everyone's heard about, but something called cocooning. So, and can you talk about that, where we're talking in specifically for, say, young children?
Right. So fortunately, last year, the Centers for Disease Control made a recommendation that everybody over the age of 6 months receive a flu vaccine. So that's the universal recommendation for flu, 6 months and above. And it's important because children under the age of 6 months cannot receive the flu vaccine, but they're most vulnerable for complications because of their immune system that's immature and because they can become very ill and dehydrated very quickly. So what we want to do is make sure that everybody who is around that child or everybody who is around people who are frail or potential risk for complications associated with the flu get a flu vaccine so that you are not a carrier to one of those individuals. So we're essentially protecting them in a cocoon.
Gotcha. Well, that's really cool. So you talked about the universal recommendation. So when someone asks the question, who should get the flu? Your answer is?
Everybody over the age of 6 months every year.
Everybody
every year.
Okay. And I know there's all different types of flu vaccine. You know, of course, my kids always want the spray. They talk about it in school. Everyone's made a decision that they're going to ask their parents for the flu mist. But can you tell us a little bit about the different types of formulations that are out there?
Right. There's a number this year in particular. There's different ways of administering the flu vaccine and different dosing. But the important message is that all the flu vaccines are the same. I mean, they have the same formulation. They have the same 3 strains in them, but there's just different ways of administering them.
Good point.
Yes.
Okay.
So the flu mist is really a great vaccine for children. It's approved for people healthy people between the ages of 2 and 49, and it's administered intranasally, and it's just quick and simple, and unfortunately the flu mist container or administration still looks a little bit like a syringe, so for children they may feel a little apprehensive about it, but it's really quick and easy. And then we have vaccines that this year, you may have seen some of the advertisements on TV with the porcupine as the mascot, and that is a vaccine that's called the intradermal administration, and it's just the way that it's administered. It isn't done intramuscularly, it's done just in the tissue of the arm, and so it's a very, very short needle and very easy to administer also, and particularly for people who might be needle adverse and who are between the ages of 18 and 64, they can receive that vaccine.
So you have to be 18 and above, 18 to 64.
Right.
And basically it's just given in the
arm.
In the arm. Okay.
But it's kind of like a TB skin test.
Yeah, that's why you saw that I was doing this.
Yeah.
Okay, so it's in the arm, but it's just not like an injection that you get for your typical injection for the flu.
Right, intramuscular.
Gotcha.
And then there's the high dose, and the high dose vaccine is approved for people over the age of 65, and the idea is it has a large antigen content so that you get much more of a robust response to your immune response is much more robust because you get a much stronger dose of the same flu vaccine. It's just stronger dose, more antigen in it. And it's approved for people over 65 who, as you grow older, your immune system weakens, natural part of the aging process, so you don't launch as good of a immune response to a vaccine. That's why we give vaccine to children. So as you grow older, you may need a little bit more of a punch in order to get the same immune response to the flu vaccine. Thus the high dose.
So we've got lots of options.
Right.
So you've got the flu mist if you're between the age of 2 and 49
if you're healthy.
and healthy, so no one with certain medical problems. You have the typical traditional vaccine that that goes in the muscle, the intramuscular. Then there's the intradermal dosing, which goes just underneath the skin in the arm, and that's for 18 to 64. And then there's a high dose that's for above 65 and over, 65 and over. And that is hopefully going to give you a better, stronger response to the vaccine.
Right.
So I think I counted 4.
We have quite a menu.
Yes.
And then when we go out to public clinics or when we go to corporate businesses and offer flu vaccines, we also, our motto is get them while we got them. So we're always talking about other immunizations that are age appropriate for people, such as the tetanus, diphtheria, pertussis, or the shingles vaccine, or hepatitis vaccine, or the HPV vaccine. So depending upon your age, there may be other immunizations that you might need a little bit of information about as well. So the flu season is a great time to talk about immunizations in general.
Get them while you got them.
That's right.
I like that. Yeah. So let me ask you, just quickly talking about the flu again, but I do want to, if we have time to talk about some of the other vaccines.
Sure.
I think you're right. Get them while you got them. We've got people listening, learning about vaccines. This is a good time to talk about it. But when we know we've got all those vaccine choices out there, is there a good time to get the vaccine? We talked about that every year is unpredictable. What is your advice for people?
Generally, the CDC recommends as soon as the vaccine is available to start immunizing. And so we generally start immunizing September, October, so that people have a chance to launch an immune response, but also so that it isn't too early, because the vaccine generally, they say, lasts for about 6 months. So if you get it too early in the year, too early in the season, then it isn't protective for that peak in January, February that we were talking about earlier. So, but we, people, we always encourage people to get it before we anticipate the flu season, because people start becoming ill when they're indoors and closing windows and so on. And so we want them to get the vaccine before that. The problem is that people are contagious for up to 24 hours before they even show symptoms of the flu. And so people may come into work, they may be engaging with people and spreading droplets like Christy described, and they don't even know they're sick. And they say for children, they can be contagious for up to 5 days before they start even showing symptoms. So no wonder the schools are the cesspools. And some theories suggest that if we immunized all the children in our country, that we wouldn't have a flu season.
Wow. So. Another reason to reach out to the schools and to the parents to make sure they get vaccinated.
Right.
So why is it, some of the vaccines that you offer, some of the vaccines that are out there, you do it once, you don't have to worry about the vaccine anymore, or you get 3 shots in your lifetime and that's it. Why do we have to get a flu shot every year?
An annual vaccination is important because the flu strains change. They change through the drift and they change through various different mechanisms. And so every year the flu season may be different. And so we watch what's happening in the subcontinent, and we watch what's been happening throughout the flu season the previous year to know what we think will be circulating, and then make a decision about what should be included in that flu vaccine for the coming year. So every year, because we can't be sure about that the flu season, the flu virus itself is always changing.
Right, so our immunity wanes, and then we don't know if the stuff that was the vaccine, the virus that was circulating last year will be the ones that are circulating in the next season. So we do use surveillance to see what type of strains we're going to put in the vaccine, so the vaccine changes as well.
Right.
Awesome. Well, I want to make sure, we have just a few minutes, and I want to make sure that we get some, remind people why they need to get the flu shot. We talked about that. And sometimes they need to know where to get the vaccine. So I know that you offer the vaccines, and you mentioned some of the places. Is there a number? Is there a place that they can, you probably have your phone number or a website?
Sure, we have an immunization clinic, 648-3777, or they can go to our website, www.ccvna.com. And one of the nice programs that we offer is that we do go to corporate businesses. So if you want to keep your employees healthy during the flu season, offer them a flu vaccine. And the return on investment is great.
Yeah.
For a $25 investment, you can keep your people on the job and keep your not only your people, but making a contribution to their families and to the community, keeping people healthy and on the job.
It raises morale, too.
Yes,
I would
that's
say,
right.
Wow, that was really nice. My boss cares about me.
Right.
So again, give me the number again.
648-3777.
Okay. And you also, besides offering flu vaccination, you mentioned several other vaccines.
Right. We offer international travel immunizations. And interestingly enough, in that program, we offer flu vaccines up until June when the vaccine expires, because as I mentioned, you know, if you're going to Australia, it's winter there and summer here. In the tropics, the flu circulates year-round, and so you really want to be protected from the flu. As you know, if you've been on an airplane recently, it's well documented that's where respiratory diseases circulate. You never know who's on the plane with you, and they could be from an area that the flu is active, and then you're breathing their recirculated air, so you're at risk. So in our International Travel Immunization Clinic, we offer all the vaccines for travel, and often are administering the flu vaccine throughout the year. So our motto is the flu ends with you, and so we offer the flu vaccine to our patients who are on home care, our patients who are on hospice, and throughout the community.
Well, thank you, Andrea. You were right. We could have talked a whole hour. We had a bunch of questions, and we couldn't answer them, but the most important ones we answered, and I appreciate you taking the time out today to talk to us and give us more information about the flu vaccine and the flu season. So we're going to take a quick break. I'm Dr. Lisa Hernandez, your host for Your Health television program. Don't go away.